and protocols. But here to discuss how we're making sure that we're on the lookout for these variants is Dr. Massen. She's the Chief Laboratory Officer for the North Dakota Department of Health, has been a regular contributor to these press briefings, and she's done a great job of overseeing the outstanding North Dakota State Lab, which has, of course, had to expand its testing capacity manyfold to get us through this emergency. Dr. Massen, good to have you.
Thank you, Governor Burgum, and welcome everybody. Yes, I'm here to talk to you just a little bit about what the Public Health Laboratory is doing to watch for these variants. We actually started performing what's called whole genome sequencing back in May. And so that's one of the tests that we use to kind of confirm and identify different variants that are out there. However, in December, when we started to see more of these variants, we started to become very aggressive in how we were working towards screening for them. Like Governor Burgum said, to date, we have not seen any identified cases associated with the primary variants that CDC has identified, and that's, of course, the UK, the South African, and the Brazilian variants. But again, remember, it's very normal for us to see variants. That's kind of what viruses do. They mutate as they go. We see this with other illnesses, but we want to pay particular attention to those that could potentially threaten during this pandemic. So again, do we think that we have these variants in North Dakota? It's entirely possible. We just haven't identified or have lab confirmation of them just yet. It's very likely that we'll see them in the state as they move through the U.S., but we're working hard to make sure that we identify them hopefully as soon as we see them enter our state. And to do that, we're being very strategic in how we're screening our results. We are actually able to screen most of the positive samples that come through the public health lab for the variant. And there's a number of different ways that we can do that. One way is that we watch our raw data and our CT values for particular signs to help us. We also lean heavily on the Division of Disease Control after their case investigations to let us know if they have a particular case of interest that they would like further testing done on. So for example, they may have come across an individual that has traveled to a high-risk area for one of these variants or has been a close contact to one of those individuals. In addition to that, we're working closely with our partner at the CDC, the Center for Disease Control and Prevention, and we are actually submitting a random sample of 17 of our positives every 2 weeks to them. This helps promote whole genome sequencing on a national level and also helps supplement the amount of tests and whole genome sequencing that are done on positives within our state. We also are encouraging hospital and clinical laboratories around the state to submit their positive samples to us for further analysis and potentially whole genome sequencing for these variants if they receive them. We have been receiving some from some of our partners, but we encourage anyone who's doing whole genome sequencing or PCR testing to submit your samples to us so that we can do further testing. But again, I just wanted to remind everyone that because of these variants that are circulating around the U.S., it's very important to make sure that we continue to practice our COVID precautions like wearing a mask, physical distancing, staying home when you're sick, and also getting the vaccine when it's available to you. I was actually fortunate enough to get my second and final dose of the vaccine 2 weeks ago, and I'm very thankful for that opportunity. I know that's just one more step that I'm helping prevent the spread of this disease. And again, remember that if you don't feel well, to stay home when you're sick so that we can get through this. And if you do feel sick, I highly encourage you to get tested. It's one of the ways we're going to be able to identify if there's a variant present in our state. So testing is incredibly important. And remember, the test is free at this time, and it definitely will help us have a better picture of what's going on within our state. And I can stick around for any questions you may have. Thank you.
Thank you, Dr. Massen. We talked earlier about our three-pronged strategy and therapeutics being one of those, and our team is doing a great job on this front as well. During the first